I'm a grassroots football coach, and 5 years ago I tore my ACL and meniscus playing football. Hi, my name is Razvan, and this is me starting to document my journey through this whole process of ACL and meniscus reconstruction surgery. Right after the COVID restrictions got lifted, I went to play football with a couple of my friends in an indoor pitch, a wooden floor. Everything went fine until towards the end of the whole game, where I was running to get the ball, and for some reason, the way I planted my foot, I've done a little bit of a twist movement as well. I just heard a loud pop straight away, and my right knee gave in. I fell to the ground, and straight away I felt an extremely sharp pain and the feeling of I'm going to be sick. I remember I couldn't move for quite a good couple of minutes, and the pain level was absolutely insane. After a couple of minutes, I was able to walk on my own feet again. I guess that was the adrenaline kicking in, and I didn't feel much pain. It was more of a pressure feeling, but the swelling was already setting in. I managed to drive back home, and I started icing it a lot using a couple of anti-inflammatory creams, and that did work, and they did a trick. They helped a lot. But because in the past I've never had anyone in my circle of friends having this type of issue with their knee or type of injury, I didn't think I might have it. I'll be honest, I didn't really know much about it at that time, what an ACL tear and meniscus fully means, and I didn't mind it a lot. After a good couple of weeks, after the swelling and stiffness went away, the pain went away, and I was able to walk normally again without any issues, I decided that it would be a good idea to go back to playing football. Then this time it was on an outside 3G pitch. Everything was fine in the beginning, but during the game I did feel once or twice my knee giving in slightly, and a very sharp pain for probably a fraction of a second, which made me to stop and stay on the side for a little bit. And then I went back in, everything was okay until I got back home, and then the swelling started to come back a little bit. So again, the whole process of icing and putting the creams on started. I did a little bit of a research online about knee injuries, and I decided that getting a sturdy knee brace would be a good idea to try and give my knee a little bit of stability. Still, I wasn't thinking of a torn ACL. That wasn't even going through my mind. I did get the knee brace. The knee brace was grand, and it was helping me a lot. I was able to play football, but again, on a game night, I was trying to dribble a lot, and I was trying to move here and there. And I'm not a very light weight guy. I was quite overweight, especially after COVID, where restrictions and movement was limited, very limited. Unfortunately, I never thought of that, and I never kept that in mind, that it might affect my knees, and my whole body wasn't fully ready for that type of effort. My knee popped again, the same noise. The pain level this time was not as bad, but the feeling of I'm going to be sick was there. The swelling came back fully. Again, I was able to walk on my own feet. I was able to drive home, but I went through the whole process again for a couple of weeks. I went to one of the A&E departments near to where I live to get it checked, and eventually I got seen by one of the doctors. He assessed my knee. He said that he can't properly give me a diagnosis, but he will make a referral for me to a specialist to be seen, and we will go from there, which was totally fine by me. I was told to wait between 2 to 4 or 4 to 6 weeks. I can't remember exactly, which I did. In the meantime, I took my first coaching course of the National Coaching Certificate, and during my exam, my knee popped out again, fell to the ground. The noise was like the pop was exactly the same. Everyone stopped and they kind of panicked a little bit, but by that time I was already used to the feeling, and the pain wasn't as bad, the swelling wasn't as bad. I was actually able to carry on and finish my course and finish my exam. 6 or 7 weeks have passed already, and I've never got the letter for me to get the appointment to the specialist. So I ended up calling the hospital where I went to the E&E department. I went that night to ask about it. And for some reason, I was not even appearing in their system of like being there that night and being seen by the doctors. There was no trace of the referral that was supposed to be done for me. And it was done in front of me because I didn't leave A&E until I've seen that the doctor was completing the referral there in front of me. And he actually told me that he will send it that night after a couple of hours. But yeah, unfortunately, something happened along the way. I don't know, maybe in the handover, it wasn't passed on, or I don't know. They didn't tell me. They wouldn't tell me what happened or why and how that is possible, but it did happen. So I took the decision to go private. I got the initial appointment with one of the doctors in Northern Ireland. I went, I got seen, I got scheduled for an MRI, done the MRI, came back for the follow-up appointment where I was diagnosed with a fully torn ACL and a partial tear of the medial meniscus. And I was told that clearly the only option for me, if I want to get back into sport and coaching, I will have to get surgery. So the doctor made my appointment through NHS and has put me on the list straight away there in front of me before leaving the office in my follow-up appointment. And I was told from the get-go that the waiting list is between 2.5 to 3 years. I did have the option to go private, which probably would have given me the next week slot to get the surgery done. But the surgery costs would have been around £7,000. I did decide that I'll wait and go through NHS. And 20 months later, I got the call and I was told that my time came to get the surgery done, which made me very happy, but at the same time, a little bit of anxiety started to creep up. I've never had friends that went through this, so I didn't know what to expect. I guess I started looking up online, and I would dare to say that this was a little bit of a mistake. Not entirely, not fully, but it was a little bit of a mistake because I've seen so many videos where things have gone wrong, and that did not really help me. It kind of put me off a little bit and made my thoughts and anxiety go even higher. I think it would have been better just to stop with a couple of videos, just to look what a fully reconstruction of ACL and meniscus mean, and probably would have been okay for me instead of going through all these videos. Now I'm a couple of days away from my surgery, and this feels a little bit strange, to be honest, because during the training sessions, I used to talk to my players about different setbacks on and off the pitch, different injuries that might occur, not warming up properly, and all of these things. And I guess right now I'll have to go through this process, and I'll have to coach myself through one. I will try and document as much as possible, and I'll try to record as much as possible. I'm not sure if I'll be able to do much while I'll be in the hospital and with the surgery, but after coming back home and after starting the rehab process, I will try and get as much recording as I can. I will try and show the good days. I will try and show the bad days, because from what I've seen, there's a lot of bad days as well. It will be raw. I'm not great at editing videos. I'm not very good at talking in front of the camera yet. Hopefully this will give some sort of an authenticity to the videos and to this type of vlogging, I guess, about this whole rehab process. Probably in the next video I'll try and record everything that I have bought to get myself ready for this surgery. I guess if you're maybe a football player or sports person, if maybe you're a coach or you are a player and you have this type of injury, you have been through this type of injury, maybe I can give you a couple of tips through these videos, or maybe you can give me a couple of tips of what I should do or if I should do things differently in the comments. I guess this is me trying to document everything that comes with fully reconstruction of an ACL and meniscus surgery. Before I end the video, I just want to say that anything that will come with these videos will definitely not be a medical advice. This is my own journey. This is my own experience that I will go through. If anyone can pick up a tip from here or from there, fine, good, but I will not give any type of medical advice. Welcome to coaching myself.